Okay, on to a Fox follow-up now. We have been reporting on two local mothers who are fighting to get a drug approved for children with what's called Duchenne muscular dystrophy. It is a battle against the clock because Duchenne is aggressive and is deadly. And Christine McSherry's son and Jen McNary's two sons have Duchenne. You're joining us here. And they have been fighting for the FDA to approve a drug that they say can help their children just like their sons. And earlier this month, McSherry pleaded with the FDA right here on Fox 25.
And really, as parents, would like to make a personal plea to her to take a look at this and really look at the data and think about, you know, what is stopping them from approving this drug.
Okay, and one day later, I spoke with FDA Commissioner Margaret Hamburg. She happened to be in Cambridge for a meeting. I asked her what the holdup was. What is the holdup with this drug?
Well, let me be clear that we are very engaged with this issue. This is a serious, devastating disease. There also are advances in science that really offer new opportunities to come up with products that could change lives. We've been working so closely with these families and with the research community and with the product developers. It's in fact, I think, been one of the most intensive efforts in terms of high-level FDA engagement that I've seen during my tenure. At the present time, there is not a product application before us, but we're working with the companies in terms of developing the right data and how to present it, and progress is being made.
Okay, so she said progress was being made. Felt a little uncomfortable with my questions. That was on April 5th. Christine McSherry, Jen McNary, you're joining us now. You've got some news you want to share.
Absolutely. So yesterday, the company Sarepta Therapeutics from Cambridge, Massachusetts, announced that they had had 4 meetings with the FDA in the last several months. And as a result of those meetings, it looks like they will now be filing a new drug application by the end of 2014.
Why is this such a big step for you?
Jen?
You know, they've given the guidance that we've been hoping for, that they're going to allow a broad population of Duchenne patients, which includes our sons, non-ambulatory kids, into a follow-on trial without a placebo. So all of the kids will be on drug. So what this means is access, potentially, by September for these kids that are waiting for this drug.
And to be clear, for people who don't really understand the process, she was telling us, well, the company hasn't applied, but then we spoke to you, and you guys said, well, hey, wait a minute. The FDA has to give this company guidance.
Exactly.
And they weren't doing that. And so that's one thing she left out of that. So to put everything in perspective, and you folks have been working very, very hard to get this done, to get this through. So what kind of a milestone is this for you?
You know, this is historical. This is making history right now in Duchenne muscular dystrophy. It's the #1 fatal genetic disorder of childhood today, and we've never had this type of progress. So it's historical.
Why do you think this happened?
I think it happened because of communication and advocacy. I think communication and advocacy throughout our entire Duchenne community was so high that we demanded that the FDA take a look at the law of FDASIA. And then finally the process was acknowledged.
But how long have you been fighting?
Nearly 2 years.
Okay, so why this month? Why the last couple of months?
You know, one of the last communications that we had with the FDA was bringing 7 experts to them so that they could really teach them about the data and talk about Duchenne. And I think that really flipped a switch for them, where they started to understand how amazing this drug was and that it was working. And I think that they did take their time to really have meetings with the company that we weren't aware of.
But you folks have been going public,
yeah.
and much more recently, you've been your profile has been lifted a little bit. We've certainly featured you here. You've been fighting for this for a good long time. Do you think that it has anything to do with some of your words that have appeared on TV?
Like I said, I think it's communication and advocacy. I think that Jen and I have been able to direct it in a way that we were able to produce results. And we really relied on the fact, or the FDA relied on the fact, that it was science. They didn't go forward and make progress this week because they were sympathetic to our cause. They did understand the urgency, but they took a really good look at the science, and that's what we were asking for.
Do you think it had anything to do with any questions we posed to them?
I think it got really hard to stand in public and make statements that were the same statement over and over. So, you know, perhaps the urgency reached a boiling point at the FDA and they decided it was time to make a decision.
This helps your children?
If they follow through with these promises, it's important to remember that these are promises that are in writing, but these are not actions that have been taken yet. So if they follow through and are as flexible as they say they're going to be, then it could save our children's lives.
And other children as well.
Many other children and other rare diseases as well.
And
so it's the process.
You know, it's such a long battle. I can't even imagine what you've been going through just kind of emotionally when you got this news. And you're taking a big deep breath right now. When you got this news, what went through your mind?
You know, I think we both just started crying. It was very surreal. It was like a dream. We both had to pinch each other, and we've had many boys die in the last 18 months as well. And so for all those that have lost their lives and lost the ability to walk or lost the ability to hug their parents, it's not been for naught. We're not going to let those boys go in vain, and we will continue to fight. This isn't over. This victory isn't a closure for us.
And we're going to continue to follow your story, and you're going to tell me now what's next for you. What happens next?
So we're going to keep our foot on the pedal, and we're going to hold the FDA accountable to the words that they have spoken, and we are hoping to get more drugs to more kids as soon as possible.
And so you're headed to Washington.
So we head down to D.C. this evening as soon as we leave here. The World Orphan Drug Conference meeting is happening as we speak.
And you're going to be talking with people and educating them and kind of letting them know, and you're not letting your foot up.
We're not, and it's good to know that if people want to continue to help and support our efforts, they can go to that website again, the Race to Yes, and we'll give instructions there about keeping Congress involved and engaged. And again, we want to thank Congress. They've been very, very helpful in all of this. Senator Warren, Senator Markey, Senator Backus, or Congressman Backus, all of them.
Jen McNary, Christine McSherry, thank you so much for joining us. You're not going to let your foot up. Neither are we here at Fox 25, so we're going to keep on updating people on the progress that you're going through.
Thank you.